How to ice an injury. Hello and welcome to Videojug. Icing an injured body part is critical to the recovery and treatment process. But how do you know how and when to ice an injury? We checked in with Dr. Mark Darrow, Medical Director of the Joint Rehabilitation and Sports Medical Center in Los Angeles, for some helpful tips on how to ice an injury properly. Step 1. Swerve from the nerve.
The main thing about using ice, number one, don't put it over the area where there's a nerve. For example, if you've injured your elbow, be careful because the ulnar nerve is right in this groove that you can feel. If you over ice an area where there's a nerve, you can actually damage that nerve permanently.
Step 2. Tissue is an issue.
Number two, when you're icing an area, be sure that you have some cushion between the ice and the tissue so that you don't burn the tissue.
Step 3. Keep it moving.
Number three, make sure you're moving the ice around so that it can be distributed evenly rather than focusing just in one spot.
Step 4. 20 minutes max.
Number four is don't use ice for more than 20 minutes in an area. If you do, the blood vessels that come to the area will actually expand just like heat and cause more inflammation.
Step 5. All day long.
Ice can be used several times during a day. However, there should be a period of at least, say, an hour or so between treatments.
Step 6. Switch to heat.
After 72 hours of cooling the area using ice or cryotherapy of some form, then we'll typically switch to heat. The heating will open up the blood vessels and allow fluids to get to the area and blood to get to the area, white blood cells to get to the area. They're going to reduce the inflammation by getting rid of the toxins and bringing nutrients to the area to actually heal it.
Remember, never use heat immediately after an injury. Only use it on chronic conditions such as overuse injuries or before activities. Applying ice to the injury can be more effective than taking medications. Ice will counteract the increased blood flow to the injured area, reduce swelling, and put you on the road to recovery. Done.